So we are trying as much as possible to see how we can bring all the development partners and governments together. And in this case, we have developed what we call the county referral pathway. County referral pathway for GBV, it's a coordinated mechanism on how all of us as state actors and the non-development, the non-state actors or the development partners, how we can be able to coordinate the services that are offered to these survivors of gender-based violence. So we already have a referral pathway in place for this county, and we want to see how we can further bring in so many other development partners who can offer so many other services.
That is why the Dr. said earlier, we're trying to have GBV center, GBVRC, a main GBVRC. And in the other hospitals, we're going to have one-stop shops for where a patient comes in and gets all the services under one roof. And how we do not have a duplication of services is also by teaching the community what gender-based violence is and the types of gender-based violence that are there. There is physical, there is sexual, and as today we are actually talking about digital. Digital violence, I said earlier, it's not only online, but it's something that can actually cascade to be also offline, because it's the stalking, it's the harsh comments, it's the bad images of people that are traded online, and also this, as we said, there's also a lot of sex trafficking and human trafficking going on online. So digital violence is something that is not only online, is not restricted to be online. It's something that can actually be seen in day-to-day life. It can come out and be in the actual world.
The adolescent is really at the heart of what we intend to do. Particularly when you look at the issue of the triple threat, teenage pregnancy, new HIV infection, and SGBV, we certainly need to have interventions that are really targeting adolescents and teenagers. And that is why SHARP is actually in this county to not only work with the health department in terms of enhancing multi-sectoral collaboration, because when you look at issues of SGBV, they touch directly on the gender department and on the health department. And so for us to be able to slay this monster of teenage pregnancy, we must work together. We must enhance that collaboration. We have to work with the grassroots organizations at community level to support and collaborate with CSOs working across all the sub-counties in this Isiolo County in terms of having dialogues and sensitization forums. And these are activities we are planning jointly with the Department of Health so that we can sensitize them on issues of teenage pregnancy, on accessing the relevant information, and on the referral pathways, because policies and guidelines are only as important as the people who are aware about those. The other thing we are doing is having high-level engagements with policymakers so that we can get real commitment in terms of what we can implement in terms of rapid action towards elimination of violence and the issue of triple threat. Of course, the other thing is supporting issues of data quality, because without data, it is impossible to, plan accordingly. And so what we want to do is really support the department to do data quality management and assurance so that they can make informed decisions as a result of this.
It's like the Gender Technical Working Group. And as a commission, our role is actually to bring all the state and the non-state actors together so that we can be able to tackle some of the issues that pertain to those particular groups in our communities. And in that, the way we try as much as possible to strengthen the coordination mechanisms between the development partners is actually, one, to strengthen the county Gender Technical Working Group, then try to cascade it now to the sub-counties. So we want to, maybe in the next few years, we want to see how we can have stronger sub-county gender technical working groups. Then again, we can have ward technical working groups. Then we can be able now to strengthen the coordination mechanism. And in that, I'll also want to mention something on GBV. When we look at coordination in terms of the partnerships in gender-based violence, we look at what are these programs that many development partners are running, and how can we bring all of them together so that we can have a coordinated kind of working mechanism between all of them, so that they don't work in in silos, in the coordination of their services. Plan International are coming up with some good strategies on how we can be able to support and strengthen the coordination mechanism in terms of prevention and response to GBV. I know they have a new project for the Horn of Africa on GBV. One of the best approaches they have taken is to engage the women-led organizations in Isiolo County. And I know currently they are engaging about 10 women-led organizations. And these women-led organizations will support us in the advocacy work for gender-based violence. And I think moving forward, that is how we need actually to engage more women-led organizations, and maybe even in future engage more youth-led organizations in our county, to the sub-counties, to the wards. And they will be our champions to help us in advocacy work. So I think that is one of the best things that Plan International is bringing. We also have a lot of, we have a big gap in terms of data management, which I know it's one of the questions that was being asked earlier, that how are we trying to, to structure, data management, and how we can have kind of a common registry for all of us. And we are so much dependent on the health information systems, but I know Plan, they are working on something, a platform that if a survivor reports, they will be able to report anonymously, and all that data can be captured, and it can also be shared to all the development or the state actors. And it's some data that everyone can be able to access easily. I know they are working on a platform, and I think that will be positive on our end as a county, even as we look at issues of data management for gender-based violence.
Ya digital form of GBV ambayo hapa Isiolo imetuadhiri sana, kwa sababu wale wasichana wetu wanakutana na watu kwa mitandao, wanafanya ndoa, ama wengine wanatoroshwa kupitia kwa hii mitandao. Hii inatusumbua sana kwa sababu wanatoroka kwa shule na wanaweza kutolewa nje ya nchi. So nataka kusema tu kwa kifupi kwamba tujaribu sana kuelimisha wananchi wa Isiolo ili waweze kupambana na hii jambo ambalo ni lipya, jambo ambalo halikuwa mbeleni, la mambo ya mitandao. Watoto wetu wanapotoshwa kwa kutumia simu za bei ghali, kutumia pesa, na mara nyingine wazazi wetu pia